Now we'll demonstrate some low back techniques, and I'll also incorporate how we utilize some topical CBD tape. Take a deep breath for me. And similarly to what we do in with the cervical paraspinals, but I'm doing more deep work. So I'm not doing any of the effleurage and the Swedish massage techniques. I'm going right in doing deep stripping to the paraspinals. And I'm going to do a couple of passes to make sure I get all three, always starting with closest to the spine. Find a trigger point, hang out there. CJ, is that stinging a little bit in this spot? Not at all? Okay, good. And I'm going to do one more coming from the top of his iliac crest, going all the way up to the lower thoracic paraspinals. Now, in practice, sometimes I may go all the way from the sacrum all the way up to his cervicals, depending on what the chief complaint is and how his mobility would be. Now I'm going to focus more on the glutes. And is that stinging a little bit, CJ? Okay, I feel the trigger point. And so I'm going to have him breathe through it as I hold that spot, and I will demonstrate the same technique that I'm doing on this side, on the opposite side, so you'll be able to see it a lot better. And then as it allows me to go a little further and as the muscle releases, I'm just slowly following around, and I'm going to end up at the front of the hip flexor. And to take some work off of yourself, you can even have the client shift. Can you shift, CJ, towards that hip for me? And it just makes it easier for you to come to the front of that hip flexor. Good, and relax. So now, just going back in and rechecking. That's cleared out. I can feel something in his TFL a little bit more. So I'm going to hold this trigger point, allow him to breathe until that muscle relaxes. Important self-care tip for body workers: if it feels funny when you're doing it, lean in, use your legs. Biomechanics are very important if you're going to have longevity in this career, and oftentimes I'll see practitioners kind of twist and do some funny movements to try and get in there. Be mindful of self-care and your positions. And CJ's a little ticklish. And so I think he's probably feeling a combination of discomfort and the ticklish sensation, the sensitivity. And does that feel less intense now? It's starting to release. This one's a little more stubborn. And I'm just going to trade and now back up and come in a different direction to get that muscle to release. And I feel like it's released. Are you still feeling that sting? No, feels more like pressure. Yeah. So now you can see, and I forgot he was ticklish, so I'm going to try and do slower pressure point movements just to make him a little bit more comfortable. But I love ticklish patients. They're the most fun to work on. And demonstrate those same techniques on the opposite side so you can see. Normally I would work perpendicular to the patient, but for recording purposes, I am going to modify that. So again, stripping along those lumbar paraspinals, going kind of slow because again, his right side was the chief complaint area. And I'm finding a restriction at this transitional point or a little bit of an adhesion. Breathe for me. Good. And I'm just going to hold this point for a couple of seconds to allow that muscle to release. And I'm going to do another stripping band, just lateral to where we were, to allow that muscle to release. And then we'll also go into the glutes. Good. Now with the glutes, just going through the iliac crest, and it's definitely tighter on this right side than the left side was. And staying really close to that bone, starting to feel a trigger point in here. So I'm slowing down. Is that tender? And breathe in this spot for me. Be mindful of your hand position when you're working in this area as well. I always like to let the clients know where I'm going to be working because you're really close to some sensitive private areas. And if you notice, my fingers are kind of hanging out on top where I'm not just putting my hand over his sacrum. And I felt that release. Is it stinging around the same amount or is it more of a pressure? Okay. Okay. And then I'm just going to shift a little bit, which may increase that. How's that feel? Yep. Okay. And so we'll have him breathe through this spot. And I'm going to come around slowly because I feel it releasing. Now I'm going to switch hands because my thumb is fatiguing. And now at this point, I'm going to have him shift towards this side. Perfect. So I can come right to the front of that hip flexor. And you can tell how I'm using my body mechanics to kind of do a lunge into it so that I can help with a little bit more force and relax. And so now if we check the pelvis, you can see just that little bit of work. He's moving on both sides. He doesn't have that restriction. To wrap up this segment, I would like to show you how to use some CBD-infused KT tape just to help stabilize. I like to tape low backs to just give them a little bit of support. It's going to help with the healing process, and non-CBD infused tape is beneficial with the CBD infused tape, and we're going to use a broad spectrum hemp product. What that's going to do is just help with a little bit of the inflammation that he's going to have, because working on him and especially doing this type of deep work, more than likely he's going to have a little bit of inflammatory response from the body, and it's going to help him with the pain. So with the tape, I'm going to tape his lower paraspinals all the way to the top of his sacrum. And this particular tape is broad spectrum, 0% THC. First thing that I do is I will tear the tape in the center, peel back so that I'm not touching the tape, and then apply, going a little bit higher. Some classes, if you take a taping class, they'll usually have you stretch the tape, but I find you don't really need to. You can apply the tape in several ways. For videotaping purposes, I am applying the tape with the patient prone, but in the office, at times I will tape them in a flexed position. I apply 2 strips, 1 to each side of the paraspinals. And then you always want to have a stabilizing piece, which we're going to take that right across the top of the iliac crest. Again, tearing in the center. And this is just going to apply some stability to the muscles, help with the healing process by giving him that constant pressure. And it also helps bring their awareness a little bit more to the posture. Now, patients can leave the tape on for 3 to 4 days if they don't saturate the tape, but if they're swimming and they like to take long showers, then it'll last probably a day or until their next shower. I always give the clients and patients instructions on removing the tape. It is not waxing tape, so you do not want to take it off fast and rip it off because it can take your skin with it. So you always want to take it off slowly, start with one of the edges, and if the adhesive is still quite sticky, then you can saturate the tape with any type of oil. Some individuals like baby oil. I have cooking oil readily available, so you can saturate it with olive oil, sunflower oil, avocado oil. It doesn't matter. Any type of oil. Suntan oil will also help. It'll just lubricate it and get rid of that adhesion. The other consideration when using tape in your practice is you would want to make sure that you if you have a patient that has sensitive skin, although there's no latex in any of the products that I've seen, have not had latex in it when I'm looking at the CBD tapes. But if they have sensitive skin, they may be sensitive to what's in the adhesive. So now we finished taping the lumbar paraspinals. We also gave a support piece here, so I do like to use 3 pieces of tape for the low back. Also with the neck, I would do this in reverse where you're stabilizing at the top here. So with the tape, you see we're stabilizing across the top of the iliac crest, started from the sacrum all the way up to the paraspinals. You can cut strips, you can cut, and if you're using a roll that's not pre-cut, you can cut and customize those to your likings. One of the benefits to taping someone when they're prone is if they have a hot low back or dealing with, some intense, severe, acute pain or chronic at the same time. The other option is, do you mind just putting your elbows on your thighs? You can tape a client or a patient in flexion, which will give you a little bit more of support for them, especially if their primary chief complaints occur when they're bending forward. And come back up. Now, one of the reasons why I like to use the CBD-infused tape is because our work does cause inflammation, but it also, CBD-infused tape is going to help speed up the recovery process because it's also infused, so it's going to help modulate the pain. And if you remember from earlier modules, the neuroprotective and neuroregenerative responses of cannabis, it helps protect the nerves and it helps speed up the healing process.